Hi, Dr. Payne. I'm Renee Hansen-Malone. I'm the new executive director at Austin Smiles. Thanks so much for being a part of this.
Oh yeah, you're welcome.
I'm so sorry I didn't get to meet you in person. We really wish we could have all gone down to Guatemala. And we want to
Yeah.
introduce you to our wonderful doctor at El Centro Mor here. Ligia, do you want to introduce yourself?
Yes, thank you, Renee. Nice to meet you, Dr. Payne. My name is Ligia Figueroa. I'm a pediatrician, and I have been the medical director for the Moore Center for the last 9 years. So
Great. Excellent.
nice to meet you.
Yes, it's great to meet you all. I'm happy to help out. And I know that there was some questions about doing some taping for the lips, which is very helpful. And I guess in a lot of times when their premaxilla is really, really far forward, their lip is sticking out. I typically like to use some brown tape. I'll try to show you that. This tape is more of a heat-activated tape, which works great. It's pretty, affordable, and I use that in my office on a regular basis. Some parents prefer to use the steri strips, and I've seen those used. They work pretty good too. But I like this because it's a lot more, and it tends to be a lot cheaper than the steri strips overall, as you can see. And so what I do is I will cut it down to 2/3 this width. And so I'll just cut off a piece here. So typically I'll cut it something like that, so that it's a little bit narrower for the cleft lips, because these babies are so small a lot of times that this is just a little too wide still. And so I'll cut this down. And if you get a good length to begin with, and then usually what I do is I'll cut it to the length that I want, and I'll have the parents save it so that they can cut it out the same length each time. So they'll put aside one that works, that's the right length, and they can continue to cut it, and they just measure it out each time. And then I'm going to show you with the model here. Here's a model for this is a unilateral, but if you have a bilateral, you can do pretty much the same thing. And generally what I'll do is I'll get it from one side and pull across, and that will kind of hold down and in that direction. So that's generally how I'll do it. I don't know if you could see that. And sometimes we'll use some waterproof Band-Aids, and we'll put them on the sides here to go underneath this tape so that it protects the skin if the skin starts to get irritated. Sometimes those waterproof Band-Aids can be hard to find and hard to get, but a lot of times some parents don't even mess with that. They typically will just do this.
Can I show you some pictures of?
Sure.
Because I got to see most of our primary lips on Monday, and we got a huge donation from for steri strips.
Okay.
So I tried to do some taping for some of them.
Yeah.
And I noticed it is too thin or maybe too small, the length of the steri strip to do it. But I would like you to see it.
Oh yeah, you could shift it just a little bit more. The other way. There you go.
Sure.
Oh, go the other way.
Yeah,
Perfect.
and maybe talk a little bit so you're pulling up.
So this baby, she's 3 months old. I couldn't do it to her.
Yeah,
I didn't know exactly how to do it, so I didn't do anything to her.
It's difficult because in this situation, there is, so that kid may have what we call holoprosencephaly, and that one's a little more complicated than your typical bilateral cleft. You can see there's no projection of the nose at all. There's no nasal bridge. So that the whole midline, the septum may be gone in that instance. And so the other issue is there's a bone right above the palate or part of the palate called the vomer, and that may be missing as well. And so it's really hard to and in that case, taping's not going to really help the situation. We're missing too many parts in that situation.
I didn't feel comfortable doing to her, so I didn't do any. Just the other one. Okay.
Yeah, that one could potentially benefit from some taping. It may be difficult because she's looks like she's a little bit older, so she may not want the tape.
We haven't had any surgeries since February, so most of our lip patients have grown a little bit.
Yeah.
This is one unilateral.
Oh yeah.
Yeah.
Cute little guy.
So cute.
Oh, that's a good job. That's pretty good. It's tough, and if you can try to get it down to maybe 2 of those pieces of tape, that may work for you. But yeah, that's a good job. It's tough. Sometimes it's easier with the steri strips. Sometimes it's easier with this tape. The biggest thing I have to remind the parents is that this is heat activated. So they put it on, and let me show you what I mean by that. When you put it on, it comes off pretty easily. But if I just, warm it up just for a few seconds here and just apply a little pressure and a little heat and get it to really stick down, then it stays really, really well. And it's pretty strong, as you can see on my finger. But it's this micropore tape, and it's heat activated tape. Now I can't even get it off my finger.
I don't know if we will be able to get that kind of tape here. I haven't seen it.
Yeah. What we'll do is my office will donate some, and we're going to try to send it over to you guys as well. So we'll get some for you.
Thank you. So in the meantime, we can continue using steri strips. I did to this guy. Let me see. This here. No, I can't.
Oh yeah. Okay.
But yeah, I think I didn't do a good job with him because part of the lip looks like this way.
Yeah. So sometimes it's tough to get this part of the lip, and let me show you on the model here. See if we can see this really well. So this part of the lip, sometimes you want to get the tape and pull it in together, and then once you get it the lip touching, then you can pull across. I like to, instead of going up, I like to come straight across, and sometimes this tape isn't sticking to this rubber easily. It's just not going to stick. But I like to come straight across. Going up doesn't help a whole lot, but coming straight is going to make it easier for you. And so if you can get the lip touching when you put the tape down, that'll really help make it a lot easier for you. If you do it, the other time to do it is I tell this to the parents all the time, is if the baby is crying, it's really hard to apply the tape. It's just like, the lip is spread apart really big. And so it's easier when they're calm and they're maybe sleeping or resting or something, then you can sneak in and put the tape on. Yeah.
That's what I told moms, because we gave 8 bags of steri strip to each mom, and I told them to try to do it when their baby was sleeping. It will be easier for them, but make sure that the baby is full asleep so they will not interrupt their sleeping time.
Yes, definitely.
And then I have cases like this one.
Yes.
It's kind of bigger. This is not a good picture.
Yeah.
But I couldn't actually pull it.
Yeah, so that's where this is probably going to work better for you because it's a little bit longer. But definitely what you want to do is put it here first, and obviously bring the lip in and tape across all the way across, and again pull this side and tape across to the cheeks as much as possible, and it's basically straight across for the baby. That will slowly over time pull that that lip down, and that will help a lot for the baby.
Very helpful.
Yeah, that one's a little bit easier to tape, but looks like taping would help compared to the other one.
Yeah.
Oh, good. Yeah, it's tough because if you don't have enough length, like with those steri strips, you just need a little bit longer, probably about 2 centimeters longer, and you would be perfect.
Yeah, that's what I felt with that, that it's a little short. I think it's thin enough for the size of the faces, but it's too short.
Yeah. Yeah, I agree.
Yeah. Mm-hmm.
Excellent. And that's one where you see it's off to the side. I don't know if the taping is going to be able to move that premaxilla. In my office, I use the NAM, the nasal alveolar molding, and that's more time intensive and difficult to do. But in that case, I would tape in that one as well. But as you see, it's kind of off to one side. It's going to be difficult to get it to the midline just with taping.
So I tried to do it, but I think I didn't do a good job because like one side looks much more open than the other.
Yeah, and it's going to be that way. That one's the challenging one because you really need a NAM device to push it over to one side. That's a tough one to deal with. Yeah.
Yeah. So these were all the patients that were able to come. We have more patients, but it has been very hard and tough for them to travel from one city to another. And I was explaining to Elise that we currently don't have any public transportation yet.
Oh,
so
wow.
For these families, it's really, really not only hard to come, but as well expensive. So, and most of them came because we were giving these food bags that they will take home that will help the entire family. So.
Yeah. Well, that's great. Well, it sounds like you've got your hands full, and it's extremely difficult times right now. And, whatever I can do to help, I'm happy to help. And I think we'll get you better tape. That's a little bit longer. I think that will be your success. You'll be able to work on that a little bit better for you.
Thank you very much. And thank you very much for your time. I really enjoy it and learn a lot. And I will send you pictures of the kids next month when they come and we do it again.
Excellent. Well, I really appreciate it. Thanks for doing everything that you're doing there.